Not a...
I feel like I'm an optometrist now.
I can't read it.
All right, I've got one.
Oh, thanks. Oh, it's nice. Going to a lot of efforts,
Well, yes, I'm very thankful. Dr. Seymour's put a lot of effort into this.
Yeah.
Colours and that, so that's amazing. Thanks. Put a lot of effort into everything. That's easy.
Everybody's got some food.
Yes.
Everyone's happy.
You know, I thought Chris was going to introduce me, but
What?
I'll...
This is Dr. Seymour.
No, the bio there. Anyway, it doesn't matter. Don't worry.
Oh, no.
Anyway, I've been a dentist since 1985, and so I've been in practice in Dulwich Hill since 1988. So I've been in general practice, and the main, my eldest son has autism, so I'm familiar with sort of diet control in terms of the disease and so forth. So it's not. Crystal told me what situation I wasn't sort of like, that's a bit weird. It's not, because my son goes through all this stuff himself. He's on a gluten-free diet. He releases low zinc levels, which causes his behaviour to be a bit different. He has not much speech, so we can't tell me he's got a problem. We have to figure it out. And so, you know, it's something new to me. So when Crystal sort of mentioned about it, I said, yeah, well, that's no problem. I'm happy to talk about it. So, basically, the basic line to take home from this is there's no medical cure at the moment for hypoglycemia, but awareness and prevention is the answer. Okay, so you've got to be aware that you've got a problem, and you've got to prevent it. And a lot of the stuff I'm going to talk about is general prevention and general well-being anyway, for a person's, for their life. You know, it's going to be better for their life anyway. But there's certain different aspects of hypoglycemia a little bit different to people. So what I've done is Crystal's going to put a link to the blogs at some point. Crystal? Mentioned a long time ago, but anyway, this is on my website. But I'm hoping that the hypoglycemic site have a link to it. So instead of having to search, I'm happy you to go to my website. That's fine. But I thought I'd help out the site by the articles are linked free, and then you can just log onto it and look at it. So they're the blogs that I've printed out for you, so you can take it home and read it at leisure. So I'll go through. You may already know this, so I'm going to go through the whole definition of hypoglycemia. Basically, hypo, which means less, glycemia means low blood sugar level. It's caused by excessive insulin. So we all know that insulin is produced by the pancreas. Now, what insulin does, it absorbs the glucose out of the blood into the cells, and so otherwise cells won't drive it. So glucose is your engine. It's the fuel for the body. But what happens with excessive insulin, it pulls out too much glucose out of the blood, because you need free glucose to get around to other parts of the body, so the other cells can get the food. So what happens then, he reduces the amount of glucose floating around, and the other part of the body needs glucose a lot, is the brain. So typically a person who has a lot of sugar, who ingests sugar or caffeine, gets a spike in their blood sugar levels. Then in about 2 hours later, they get a low. So that's the insulin kicking in, over-kicking in. So the free sugar levels spike, so you get a high, and then they drop dramatically, and then you get a low. So the main issue is the brain is very sensitive to glucose levels. So that's why you get incorrect function of the brain. So you get, mood levels get affected, and in the long term you can get anxiety, chronic fatigue, and depression. So your brain's not always getting a constant feed; it's spiking up and down all the time. But your body adapts and adapts and adapts, and eventually it doesn't adapt as well. So the other flip side of hypoglycemia is the fact that when your sugar levels are low, the body says, all right, I've got to kick them back up again. And that's when the adrenaline comes in. So you get this big adrenaline boost, and it kicks up the blood sugar levels back up. But obviously, adrenaline is a stress
Hormonal
chemical.
reaction.
Yeah. So you're getting, and then that also has its own problems. So having it too many times, you can start to have other problems. And the main, and a typical, as you probably know, a typical symptom of hypoglycemia, you tend to wake up in the middle of the night. Why that is, your blood sugar levels drop when you're asleep. Now, it's okay for most people, but if yours is already low as it is, it keeps dropping and dropping, your body goes, oh, I haven't got enough. Adrenaline kicks in and you wake up. The adrenaline's there to get going, to run, to stuff.
Grind your teeth and have night lights.
Yeah, and obviously if you keep having, if the levels of adrenaline are too high, eventually you start to get problems with your arteries, they get damaged, and this may long-term lead to heart attack and stroke.
How does that happen, though, the adrenaline in your arteries?
Well, what adrenaline does, it actually closes your arteries down. There's a little in the arterioles. There's arteries just beyond the capillaries. So you've got your veins and you get the capillaries that's where all the glucose is given to the cells. So before that, to control the amount of blood flow, there's little muscles in the arterial walls. So they can constrict and contract. And what adrenaline does, it constricts them, stops the blood flow. Over time, eventually you start to get narrowing of the arteries. So you're not getting the same amount of flexibility.
Because of the squeezing?
That's right, because adrenaline's doing that. It does all sorts of other issues as well. But constant adrenaline means your peripheral circulation starts to drop as well. You don't get the same amount of blood flow. So over time, you're not getting the same elasticity. You keep doing it all the time. I mean, that's sort of getting beyond what I'm going to talk about. That's long-term effects. Is that keep having adrenaline all the time is not a good thing. So now I think I'll talk about it a bit more. Let's see. Let's get into that. Okay, so that's the other aspect of it there. Now, this leads us to the problem is if you keep having, if these levels of blood sugar fall, the brain's impaired, if it's too high. We've talked about the arteries are getting damaged because of long-term problems of the adrenaline being released. Now, eventually what happens is you get to a situation of insulin resistance, which is a precursor to diabetes. So basically you run out of insulin. You just keep producing too much and it just eventually runs out. Now, let's talk about from a dentist's point of view. Because of the sensitivity, most people go to the dentist are a little bit nervous. Okay, so what tends to happen when you're a bit nervous, you've got your adrenaline going, you probably haven't eaten much, probably glucose levels aren't normal, so your glucose levels drop. So your ability to cope with things is not as good. So what I tend to tell my patients, make sure that before they come in.
Yes.
So
Make sure you've eaten.
before they come in.
Yeah,
Right?
yeah.
A lot of people skip meals, they're so nervous they skip it. The sugar levels are really low. Hypoglycemic even lower. Right? So they get there, they're really, they're getting lightheaded because there's not enough sugar going to the brain. And then, so they're sitting there and then they're getting nervous, so the adrenaline kicks in. Okay? So they get this sort of sudden, I'm feeling a bit better, but there's not there's no food in there, so eventually all the glucose is something there, so they just faint or they collapse in a heap or they just pass out and so forth. So, so you get the fight situation where you want to go, you want to get out, but you don't, so you're stuck. So the adrenaline kicks in and then the blood pressure starts to drop because you're not getting, there's all sorts of reactions that go. You get the butterflies in the stomach. There's a nerve that connects to the vagus nerve connects to your heart and also to your stomach. So you get the butterflies, head modifies your heart rate, and you're all confused. The brain's not getting enough sugar, so you faint. So you collapse and either go pale and so forth. So from their point of view, we really like you to eat before you come in. so that we don't have to deal with
Yeah.
that. And especially if they're going to have any surgical procedure, because it's only local anaesthetic, we're not doing general anaesthetics. Then make sure before you come in. And if you're obviously really, really nervous and you're having issues, then there's other means of coping with it. So, for example...
Excuse me. Look, I can't understand, I mean, I'm always nervous, Rick. I can't understand if people go to the dentist in the 21st century how they get nervous. They think, thank goodness I'm going, and afterwards everything's okay, got them for another 6 months. We've got to eat with something. I don't know, they haven't got much to worry about, have they? Worrying about, concerned about going to the dentist, I don't think.
Yeah, well, it's...
That's because you're going regularly, and most people don't go regularly.
That's right.
Yeah, but I was going since I was in the 40s, we found to go all
Yeah,
okay.
60% of the population don't go regularly to dentists, only go when they've got a pain.
That's ridiculous.
60%. And 2 or 3 people die a year from dental complications.
Sorry, pardon?
2 or 3 people a year now are dying.
How do you feel the dying?
2 to 3 people a year are dying from dental
Two?
related,
Two feel the dental. Yeah.
How though?
which was unheard of.
Yeah.
So,
My father died of dental complications after his teeth were ripped out when he was over 80 years of age. Put on a train, blood down the front of his shirt. He fell on the railway tracks. He was lucky to come out of it alive.
well, that's not the dental treatment. That's afterwards for yeah. That's obviously post-operative care and things like that comes into that. as
Yeah, well, they all need to be considered. That's why certain people really need to be in hospital when they have their teeth attended
People
to.
just need to look after themselves and do
Well,
a follow-up treatment.
Yeah, so that's just the visit to the dentist. The other thing also we do is when you have procedures, you don't get people up too quickly because they're already nervous, their blood pressure's dropped. So we gradually get you out of the chair. You get you lie there for a minute or two, then you sit up a bit, wait a couple of minutes or two, then you walk out. So because there's a thing called postural hypotension, which basically means the posture. Right, so if someone faints, the worst, if you want to kill somebody, when they faint, you sit them up. There's no blood pressure going to the brain. You always that's why you faint, you lie down, you fall flat. So you're not fighting gravity. So that's right. So that's why we gradually get people out of the chair. So hopefully they, make sure that their eyes aren't spinning around, which means they're dizzy and things like that. The people want to get out of the place. So just hang on a second. I don't want to have to pick you up and carry you out of here. So that's right. The other thing also is that some people may be a little bit sensitive to the adrenaline and some of the anaesthetics. So there's different anaesthetics that have adrenaline in it, just to make sure it's might be a little bit sensitive because you might get an adrenaline pick up. But the most important thing is to try and your body produces much more adrenaline than an anaesthetic. So we've got to try and reduce the anxiety. And some people, in some cases, if they're really, really nervous, we can sedate them, put them, give them a drip.
I think a lot of people request that, don't they, if they're really over?
I wouldn't say a lot, but it's available.
I've heard people say that. I don't want to be, I want to be put under it.
Yeah, so this is just the picture. This is the main thing to show. So you get sedated. Basically, the common thing is they use Valium and they put into your vein, and Valium intravenously gives you amnesia. So you're conscious, but you don't remember anything. So that's good because it means you can get the bite right. You're not sort of general anaesthetic, find out what's going on. There's also a small complication of general anaesthetics. We get a doctor come in and he deals with all the medical side of it, make sure they're all okay and stuff like that. I just do what I have to do. But it makes it easier. They're conscious, have to be careful a couple of hours afterwards because they can't drive and things like that.
Are there any alternatives to Valium?
Well, that's a doctor decide. Depends on the person. Different types of things, but the main thing is the purpose of sedation is so you sedate it, you don't remember anything, but you're conscious. General anaesthetic, obviously, when they give you general anaesthetic, they give you some chemical which actually stops your muscle functioning. That's why you have to be ventilated. Well, they don't work. That's why you have to ventilate, you keep breathing and so forth. Which is a bit hard work because everything's flopsy. So, people, when they're sedated, they still respond to you. Open this, do this and stuff like that, and they respond. But afterwards, they don't remember anything. So the basic, the premise is to reduce anxiety. So you give people an option. Obviously, you know, you don't want to have people getting sedated all the time. Hopefully you get to the point where they get relaxed enough that they just get treatment done. Obviously initially for some people it's a lot of work. Get that out of the way and hopefully they come out regularly so that they get things done and it's prevention's there.
But if they don't come back regularly, I wouldn't be bothered treating them. It's just it's their own fault. That's stupidity and carelessness. They weren't taught properly, educated properly by their parents.
60%.
Anyway, I'm getting to the prevention bit there, but
but you're wasting your time doing it. They're not going to come back and follow up. They're wasting your time.
Well, I can't. If a person comes in and they're in pain and they want to be treated, you can't just turn them away. You have to treat them, but it gives you an opportunity to let them know why you should do things a certain way. Now, I might not get through the first time, but you don't know. You may have an effect. You have no way of knowing.
That's right.
But if you've at least given the information, you've got a chance, right? And the thing is, they might go away and, like kids, you know, they have to hurt themselves if they realise, oh, maybe mum and dad were correct in saying things, you know. So hopefully that's what you're trying to do. You're trying to give them the reason, and you say, look, you've got to come back. This is going to hurt you. This hole is going to become a problem. No, don't hurt anything. And then 2 months later it hurts, and then they come back, shoot you, say, oh, you're right. But you don't harass them, because the thing is, I often tell patients, the worst patient is the one that's not sitting in the chair.
That's
right?
true.
You're here. So I'm not going to knock you for... I'm going to say, look, you know, you could have avoided this, but I'm not going to go and harass them, because I'm trying to help them to come in here. I'm trying to educate them. And hopefully they'll do the right thing, and, you know...
But the parents should have educated them, but they probably weren't capable.
Listen, when they get... I tell you how many times I've seen a child come in till they get finish high school, doing the right thing, go to university, and it goes to pot. It goes to pot. And their mouth's got like 10 holes.
It does, yeah.
Because they're studying, they're partying, or they're studying and not partying, and they're just killing themselves because they've got a 40-hour week, and then they go home and study another 5 hours a night and stuff like that, and they're hitting the captain.
Yeah, right.
So,
So the caffeine is damaging the teeth.
I'll get into that. I'll get into that.
Of living in a
So that's
society these days.
That's mainly to control the anxiety, and basically what I was trying to talk to you about is what the aspect of hypoglycemia is. It's to do with sugar levels and the adrenaline issues, and obviously with those issues it can affect your visit to the dentist, obviously affects your general health, and then these are going to flow on to the next bit about the mouth and so forth. Now, this is what I like to critique. Excessive sugar and caffeine are not good for you as a general rule anyway. Even forget about the hypoglycemia. I just got the National Geographic today, a couple of days ago, and I talked about sugar. Now, sugar originated in New Guinea in the 1600s. That's where it originally came from. And then it went around through the southeast islands, and eventually the Muslim empire carried through there, and eventually hit the Crusaders, and then they said, this is nice stuff, but we can't grow it here. Then they found the Jamaican islands and so forth, and they said, oh, let's get some slaves in, and away we go. But sugar is only meant to be a sugar hit, not a staple diet. And in 1960s, a scientist said it's not the fat that's the issue, it's sugar. But they said no. So then we have all this preoccupation with cholesterol and fats and so forth. But fats is a long-term burning energy source. Sugar is more like a survival thing. I have to have something quickly to survive. Now what happens is everything is fat-free, but not sugar-free. So they've compensated with too much sugar. The last couple of years, I've noticed people saying, I tell them you've got to cut down the sugar, and they're telling me now I can't. So because sugar it stimulates the pleasure parts of the brain, and then they just you get addicted to it. You keep wanting it,
Starts you off your addictive thought process.
So that's interesting because I'm surprised now. Now I think what's happening is that kids are having sugar from a very early age, which never used to be like that. And they've just gotten used to it so much throughout their whole lives. And now it's actually changed the biochemical nature of your brain. No, I can't. I don't know if it's true or not, but it seems to be logical. Yeah, now the teenagers and young 20s are telling me this. And I'm
But
thinking,
it's not just in food, it's in all drink,
It's
fluid
everything.
substance, everything.
There's sugar
It's
in
everything you've got.
and the funny thing
You
is
never think would need
fructose
sugar in it.
fructose is metabolised in the liver and it turns it into triglycerides. Fructose is not as regulated as glucose. So syrups have fructose.
Anything that ends in ose, stay away
Yeah, but
from.
fructose is a really bad one.
Lactose.
Fructose.
Lactose.
Sucrose is fructose and glucose joined.
Dextrose.
Yeah, but fructose is
But,
Ose.
but that's not.
Anything in ose.
But that's not
Stay
actually
away.
eating fruit. It's
well,
just
it's in
eating
fruit as
It
well,
is
but
in
but obviously we have it refined that it's in much higher
Oh,
concentration.
and of course they put in all sorts of.
And you've got roughage in fruit, which tends to
Yeah.
dilute it out and
Like
stuff.
not fruit juice. 'Cause I mean,
Yeah.
drink-
Fruit juice is
you
a
drink
lot of
bottle
fruits are put
orange
into it.
juice, it's like, do you sit down and eat 6 oranges in a sitting?
No.
That's how much juice is, how many oranges is
Yes.
in one bottle of orange juice.
So the pretty colours and everything like that attract all the kids and stuff like that. Now, with coffee and caffeine. Okay, so let me go back to you. So now we're talking about diet. And I'll go through the hypoglycemic diet, but I'll give you some reasons behind hypoglycemic diet. What caffeine does, caffeine actually dries out your saliva. It also helps you kick adrenaline as well, but it dries out your saliva.
How does it do that?
What does it do with it?
Well, it stops the saliva being produced. That's just the way it works.
So it interferes with the gland.
With production of saliva in the glands. Okay, so it impairs that. And so because you have dryish mouth, your saliva protects your teeth. It's called a buffer. So it neutralises acidity. Another thing that will muck up saliva is smoking. The smoking shuts down the blood vessels at the ends of the body. The blood vessels go to your salivary glands, they shut them down so you get as much saliva. Well, adrenaline does too. That's why you get it when you're stressed out, your mouth dries. Certain drugs also dry your mouth out as well. The big one that's going to do all problems is the Red Bull drinks that have high caffeine, high acidity and high sugar. Alright? And people get quite addicted to that stuff because they get the kick.
Not
And
just
a lot
that,
of-
the vodka that goes in it.
Well, that's adding on to it. But a lot of uni students are hitting it because they want to be up, they want to be awake, they want to be stimulated to study and do stuff like that. And so the whole combination just is really terrible. So the caffeine and saliva has a couple of numerous functions, but the main one is it's a buffer. It's also part of the immune system. There's antibodies called IgA which help fight germs in your mouth, and it also replaces the surface of the teeth. So the surface of it is dissolving and remineralising, dissolving, remineralising. But if you don't have saliva there, there's a net loss of the surface of the tooth. So the teeth become soft. They become less resistant to decay. The bacteria that hurt your teeth love acid. They also produce acid, lactic acid. Right? So you don't have the buffer capacity of the saliva, so there's more acidity, which favours the bacteria. Everyone's got the good and bad bacteria in terms of from a tooth's point of view. But different environments, if you change the environment, you favour certain bacteria. So you get a more acidic mouth. Acid also makes the tooth structure dissolve as well. There's nothing to replace the tooth structure because the saliva is not there with calcium products. Because remember, saliva is basically a filtrate of your blood. Okay? So you've got calcium. You've got the immune system's not helping you. You're favouring the germs. So what happens? You get a high decay rate. Soft teeth, they wear. Okay.
If you combine the fluoride in the water system, I guess that's the ultimate disaster.
Well, people don't drink water.
Tap water anyway.
They don't drink tap water. They go and get bottled water, or, which usually happens, Coke is the water. Right? Now, the other thing also is the flip side of saliva. It also helps break down food. So it switches from being a buffer. When you have food, it switches then to becoming digestive, which means it's in that non-buffer state. Okay, so lots and lots of sugar meals means you're permanently in non-buffering, which means the surface of the tooth is dissolving and becoming soft.
Does your saliva deteriorate as age?
It does with age, but most of it we find is medication. Through any medication, no matter what it is, affects saliva. There's a nervous system that regulates salivary glands, and a lot of medications affect that. It's called parasympathetic, but basically that salivary gland is regulated by that part of the nervous system, and a lot of medications affect that.
Is N.S.W one of those?
Yeah, you have to look. Well, yes, it would be one of those. You tend to get dry mouth with that sort of medication.
Although it is when you first, but then you get after a few months, it doesn't seem to.
But not everyone. That's a problem with everyone's different cocktail. Different things happen. So you have to. Yes, it's like if I show the memes, you can see all the side effects of everything. Because everyone says one person notifies it, we'll have to put it in. It doesn't say how many or how often, but it means you've got to be aware of it. And if you still have it, then they can swap medications and play around with it. They titrate, give you a little bit at first and see how you go. Increase the dosage to what you want. If there's no side effects, fantastic. So that's part of it. That's another thing. Part of that is it affects that. It also causes your sugar levels to affect the sugar levels as well. So that's why you should try not to cut down the amount of caffeine. Cola's got caffeine. Right? That's the issue. It's caffeine's in everything, lots of things.
And decaffeinated coffee, is that just a lot of baloney?
Well, no, that's okay if it's got no sugar in it.
Yeah.
People stick in.
They put too many chemicals in it to make it worth drinking because
I'm not sure.
they're just
I didn't research
substituting
that.
caffeine to draw out the caffeine.
Yeah, but the way they make decaffeinated coffee frightens others.
The way they.
Well, that's what I'm saying. They put too many. They're carcinogens. They're carcinogens.
It's like with anything. It's moderation of anything. If you want drugs that dry your mouth out, don't add to it.
Exactly.
So at the very beginning, I said it's awareness and prevention.
Yeah.
So you've got to be aware of what's going on, and don't ignore when people tell us something. Don't know what you're talking about.
Chewing gum.
Chewing gum stimulates saliva up to 5 times. That'll help. Sugarless chewing gum. Yes. So that's the safest. No side effects except the social thing. If people don't like chewing.
It encourages saliva.
That's right. And so there's certain dental gums that actually encourage it even more. And
It does aid digestion too, chewing.
yeah.
But the flip side of that, if you have hypoglycemia, for me, you chew the crap out of that thing, out of that chewing gum.
And then
It's like where your jaw is all stiff.
Well, then you might stop chewing that bit of gum and stick it underneath the chair, Crystal, before you leave the library.
Make sure you're on the diet properly, otherwise you just end up, chew
Well,
that
we'll
gum
talk about the
instead of
hypoglycemic diet.
Okay.
All right, so there it is. It's on your hand out there. It's the second. So mainly, look, the main thing with hypoglycemic diet is increase your protein intake. Okay, so the guidelines which I've got for hypoglycemic society, but I'll go through it again, is a large protein breakfast. It contains meat, preferably chicken or fish, 2 eggs.
bacon. Bacon and eggs and baked beans.
Obviously got your salt levels for other issues. You see what I mean? You got some yin and yang and everything, isn't there?
Protein.
Low GI snacks. That's a big issue, right? Because
So that's low sugar.
low sugar.
Things that meter the sugar out.
So basically the guideline is a high protein breakfast,
Yeah.
And then, let's be honest, you have a good decent breakfast, you won't feel hungry for the rest of the day.
No, you won't.
No, you won't.
But
People
you've
skip
got
it.
to eat your 5 other meals.
But the thing is that the breakfast is the most, when they say it's the most important meal, it is.
Yeah, the army
You've gone
acts on
at
its
least
stomach,
8
they
hours
say,
without
don't they?
eating.
Sorry?
The army acts on its stomach, or especially
Yes, that's
breakfast.
So a mid-morning snack, a protein-rich lunch, and then another afternoon snack. What you're trying to do is maintain a steady glucose level. You're not getting jumps up and
When
down.
it comes to your blood sugar level, you want to be flatline.
That's right. High protein dinner and a light snack. So basically, no sugar. You can see my thumbs up for the
Yep.
milk, eggs, nuts.
Nuts.
Milk, eggs, nuts. Okay. Thumbs up for veggies. Definitely thumbs up. So I should have put 2 thumbs up for that one.
Mhm.
Down.
Down. Cordial.
Oh, I never drink it.
Cordial, orange
Big,
juice.
big, lots of sugar. Huge amounts of sugar.
What about the
No Slurpees. Slurpees
What
are
about
worse,
the
they're like
sugarless cordial, like zero cake or
You
that?
can go there.
Diet.
Those Diet Cokes and things like that, they don't have sugar, they have artificial sugar.
Yeah.
Yes.
What's that all
So, which is like xylitol and things like that. Basically, the bacteria convert it to alcohol, which doesn't affect your teeth.
Yeah, yeah.
It's make sure they don't have too much acidity, they're not
Yes.
acid, and the caffeine. Diet Coke's got
Caffeine, I
Right.
Still got caffeine in it.
So there are things that are caffeine free
You
and
can't
stuff
do
like
Coke.
that.
You can't do Coke at all.
I don't
You can, well, they do have a sugar-free, caffeine-free
So
Diet Coke, but it tastes like crap.
some of
Yeah,
the
but that's because they put carcinogens in it in order
But why
to
would you-
get
you
out
don't want
the,
to drink it.
the
It
That's-
doesn't taste
that's-
like
but
Coke.
drinking a
There's
sort of
still
cake,
carcinogens.
anyway.
drinking a sort of cake and acquire the taste,
No.
acquire
You would
it.
have to
you know,
acquire
work
Well,
on it.
listen, we all train ourselves to do different things. If it's for your health, you have to train yourself to do things differently.
Your
You
brain
know?
does do it the other way.
So you have to
Your
change
brain
the way you
will
do
work
things.
with
And it's not going to happen. I tell people it's not going to happen overnight. So this trying to make gradually the effort gets better and better as time moves on. So you wean yourself off the sugar, cut down the amount of teaspoons you have in coffee. You swap things from one to the other. Like instead of having
Be prepared when you do it.
a snack
Cut
of
everything out. and
chocolate
forget
biscuit,
it.
something, have an apple instead. So you're doing something. So you're actually doing something, not just I've got to stop. Then you said, I've got to. If you eat something, it's going to make you less likely to eat something else.
We were told not, Dr. Zara said, don't have fruit on its own.
No.
You have to have fruit
With a
and.
And
fruit is dessert. You can have it after dinner or after
You got to
I think
pat
15
it.
minutes.
You said to pat it.
with carbohydrate.
Or a stick of celery or
Yeah,
cucumber or something like that. But you got to replace it with something else. You get,
But that's a vegetable.
Or a
Yes.
carrot.
but it's stopping you from eating something else that's worse.
Yes.
Yes.
See what I mean? You just got to figure it out.
You've got to replace things. You can't just cut them out.
So basically,
Do it.
honey is very lots of sticky sugar in that one.
Rice balls.
There
Use
are
rice
you
syrup.
can use rice syrup,
Rice
or
syrup.
stevia or xylitol, which are artificial sweeteners. Avoid refined carbohydrates such as white bread, which is bad.
What's the problem with honey? It's just so full of sugar.
Sugar, it's very sticky. It's also sticky. Hangs on your teeth.
Yeah.
Anything is sticky, your decay rate goes up 3-4 fold because it hangs around. It's harder to clean it. Sugary fruits such as banana and melon dates, avoid those. Vegetables, eat as much as you like. Limit the eating of pumpkin, potato and sweet potato, but other vegetables eat as
You
go
got
for it.
to limit eating. I know potato. You can't have a limited amount of.
Yeah, it's a limit eating of
A sweet
because they've
potato.
got they've got carbohydrates in it, so you have to be careful there. But
Makes you put on a lot of weight. Yeah.
But that sweet potato, I found in practice has worked very well for me
Yes.
because it's got so much nutrition.
that's right.
Keratin, the highest levels of keratin
Yes.
are in
But it
sweet
does have a
potato.
lot of
Different between
Carrots.
the white, the red, and the
But
black.
you got to
Not
regulate
carrots,
it.
No, but if I have it
sweet
together
potato,
with-
high
Yeah,
in
yeah.
carrots.
Fish.
I know, but
Yeah.
is there any difference
With protein.
between the
That's what you
red,
do.
the
Okay.
purple, and the white sweet potato?
Milk products are good.
Pardon?
Well,
All milk products are good.
the taro is supposed to be a hormonal enhancer.
Nuts and seeds, as long as they're raw and
Wild-
unsalted, don't
wild
have the
yam.
salt. Don't replace it with one with the other.
Crystal wild yam for hormonal replacement.